Thank you, and thank you for staying so late in the day. I really appreciate that. So I work in an autism-specific clinical psychology practice. It's just me. And I have a real interest in working with children, adolescents and adults on the spectrum. So the research that I'm looking at today is something that I came up with because I was I do a lot of diagnostic assessments with the ADOS and the ADIR. I also collect information from schools, so I use both Tony Atwood's Australian Scale for Asperger's Syndrome and also my own ASD student profile, which is available free on my website if you're interested in that one. That's not a screening tool, it's more of a tool that's for clinical and educational sharing of information about a particular student and their particular behaviours and interests and things. So I'm looking across the three areas in the clinic. Information from home and information from school. So when I'm doing that, often I'm working with families where they've actually been to see a number of psychologists over time and nobody's mentioned autism to them before. So I'm thinking often these psychologists have been doing a cognitive assessment or a developmental assessment with these children, and when I see them I think, gee, they're showing lots of signs of autism, so maybe they showed those behaviours when they were being assessed earlier, but perhaps the psychologist didn't pick it up or they weren't confident to write about it in the report. I think sometimes people feel like if they're not sure they shouldn't mention it. And so that can slow down the process of getting a diagnosis for families because they think, well, no one's mentioned this. And there might be other people like teachers or preschool teachers or the lady across the, on the bus or the lady over the fence or your mother-in-law who are suggesting, maybe it's time to go and talk to someone. And then you do, and then they don't say autism. And so you think, well, we've kind of covered that base. And so sometimes that can slow things down. So I'm really interested in whether there might be behaviours that children are showing during cognitive assessments or developmental assessments, and whether we can get more psychologists to be checking for those things, even if autism isn't part of the reason why they're being assessed. So sometimes we get a request for a cognitive or developmental assessment when we think that a child might have autism, but sometimes it might be that we're just interested in the way the child learns. We might think they have some learning difficulties, or they're a bit of a quirky kid, or they're really smart and we want to find out how they learn. So there could be all different reasons why these children are being assessed. Also, there are people who are doing assessments to see if people are eligible to get into particular courses or to get funding for things. And so autism might not be part of that thinking, but if we can try to train psychologists in looking for those particular behaviours, then they can be noticing those behaviours, writing about them in a report, and suggesting that families go for further assessment. So certainly we wouldn't be diagnosing children based on behaviours in a cognitive assessment, but we need to be noticing those and referring on appropriately to someone who can do things like the ADOS and the ADIR. Okay, so why would we look for autism during cognitive and developmental assessments? Well, we know, as you've heard from many of the speakers, and I'm sure people will keep talking about this over the next 2 days, that early identification and early intervention is associated with better outcomes in autism. So really any visit to a professional, whether it be your GP or a speech therapist or an OT or a psychologist, is a chance to pick up autism and refer children on for an autism assessment or an early childhood nurse. And so the more of us who are trained in noticing those signs of autism or possible signs of autism, the better chance we have of picking kids up early. So psychologists, we do training in looking at behaviours, and psychologists are often interested in behaviours, so we're probably a good group to be doing this. And also the cognitive and developmental assessments often take at least an hour, and so there's plenty of time to be looking for those behaviours. So I find cognitive and developmental assessments really interesting, and I know that makes me weird, and I'm okay with that. Many psychologists, it's not their favourite thing, and that's okay. Those of us who really enjoy doing assessments and working with kids in this way, we get quite passionate about it. There are lots of things beyond just looking at the test scores when you're doing a cognitive or a developmental assessment. I'm really interested in how kids do the assessment. So are they interested in me as somebody that they don't know very well? Will they follow my instructions? Those kinds of things. So there's all sorts of things that are challenging for a child with autism in participating in a cognitive assessment or trying not to participate in one, as the case may be. So first of all, there's an unfamiliar assessor often. Unless they've come to me for other things, they may actually, in my case, they may have met me before and know that my room has lots of toys, but often I'm seeing kids for the first time when I do these assessments. So it might be a new room. They've never seen the suitcase of materials before. They've never played with these particular blocks before. So there's lots of new things going on. Another thing is that I'm expecting them to follow my lead for about an hour to an hour and a half, which is very challenging for people on the spectrum. And I'm asking them to do what I do, not what they want to do. And I'm expecting them to perform under time pressure. So I'll sit there with a stopwatch. Sometimes I'll hide it under the table. Sometimes they'll grab it out of my hands because they're really interested in seeing the numbers change on the stopwatch. And I'll ask them questions that are not related to their special interests. Now, kids with autism will often take that as a challenge and find a way to relate them to their special interests. So they'll say, Ben 10 does that. Or they'll tell me all about dinosaurs when I ask them what a fossil is and that kind of thing. So there are opportunities there in some of the questions in a cognitive assessment for them to tell me all about their special interests, and they will. I can't tell them. There are rules for me as well. I can't tell them if they've got it right. And a lot of kids with autism need to know that. And so that can be really challenging when I say, sorry, I can't tell you whether you've got the answer right or not. They have to deal with making mistakes. And particularly in a cognitive assessment, we have to let them make mistakes a number of times in a row before we're allowed to stop doing something to make sure that we've got the absolute limit of what they can do. And particularly for kids on the autism spectrum, they tend to have skills all over the place. So where with typically developing kids, we need to get 5 zeros in a row. It might take quite a few goes to get that many zeros in a row because they'll get 4 wrong and then they'll get 1 right. So then we've got to do another 5 and then they'll get 1 right. And so it keeps going like that. And the parents are looking at me like, why are you still asking questions? But it's because we haven't got 5 in a row. So that can take quite a while. So kids might not feel like they've finished. They're not allowed to go back and do things again that they might want to try again. They have to sit and concentrate for a long time, which is hard for any kids, but particularly kids on the spectrum. And usually we don't offer them rewards for doing all this really hard work. Now, you can do that, but you need to write about it in your report. And so that's a really important thing for psychologists to know, because often we're not told that we're allowed to do that. So I have paid kids in rice bubbles. I have paid them in Warner Brothers logos. Just recently, I paid someone in ambulance stickers. And every time he started to lose interest, I go, oh, I think I've got a police car sticker here. And, oh, yes, I can do some more of those. So you can do that, but you need to write about it in the report. And that it's really important to capture that information, because that's what the teacher needs to do when they're trying to get kids to do work. So that's how we, get that really practical information. Okay, so why might we miss autism in a cognitive assessment? As I said before, often the referral question may not include autism. Psychologists who don't focus in this area may not be aware of the full range of behaviours associated with autism. Often there might be particular behaviours that they do associate with autism, but they don't see, they may not pick up on some of those high-functioning kids who have the more subtle variations of behaviours. And often there are other factors involved. So people could be thinking that the behaviours are easily explained by anxiety or ADHD or oppositional defiant disorder, their language skills and intellectual disability, or maybe they're having problems at home. And so there can be all sorts of other explanations for the behaviours, and they might not be thinking of autism. I'm not saying that all kids who show behaviours in these assessments will have autism, but sometimes we need to check what's going on with these kids, rule things in and out. And then the training that we have usually focuses on how to administer the test and how to score the test, and not so much on how children approach the assessment and how they interact with the assessor. So there's room for improvement in training of psychologists, I think. Okay, so this is clinical research, and I know many of you are clinical researchers, so I don't want to bore you to tears, but why would we do this kind of research? It's a little bit different from research that's often done in universities with nice clean samples. So often you'll see very clean research with children who have autism and nothing else, and then children who have nothing. And I don't mean nothing as in they have no possessions, I mean they have no diagnoses. And I can understand exactly why we need those studies, because we want to be really clear that the children who have autism, it's because of their autism that they're doing particular things. But when you're a psychologist working in private practice or in a school, then you're going to see kids who... we don't see a lot of children who have no diagnoses or who aren't going to end up with a diagnosis. Usually kids come to us for a reason, so there's something going on. And often, as I'm sure you're aware, kids can have more than one thing going on. And so a lot of the kids that I see who might have 2 or 3 or 4 or 5 diagnoses will be excluded from the studies where you have autism or nothing, because we can't be sure that their behaviours are to do with autism, because it might be explained by their ADHD or something else. So in real life, we need to know which behaviours, compared to behaviours shown by children with all sorts of other things going on, which ones tease out the kids who might need an autism diagnosis. Okay, so what I did, also in university studies, often the assessments are being done for the purpose of the research. And so I didn't have that. What I was really wanting to do was to look at assessments that were occurring naturally in a clinic setting or in an educational setting. So who are the kids that we usually assess, and then looking at behaviours in those assessments. Because I know, having done research, it was with people with schizophrenia, but often when we're looking for a control group, we'll go and ask all our friends if they can participate in our research. So it may not be the most representative sample. Just saying. Okay, so what I looked at was so I did an online case review. So it was a questionnaire on SurveyMonkey. A lot of them, I'll admit, were my own assessments, so 63 of those. And I also put through some assessments of kids that I'd assessed with autism who'd had a cognitive assessment before. So looking at the report of any behaviours that were included in that as well. So I can be sure about my own diagnoses, because I was using the ADOS and the ADIR, and I did ask other psychologists who were doing the diagnosing, and many of them were using the ADOS and ADIR. So I think perhaps that's to do with the people who were interested in this kind of research. So there were a number of psychologists who were kind enough to fill out the questionnaire with their own clients, and I ended up with 148 case reviews, which was wonderful, over a 12-month period. So we recruited them through emails to psychologists. I also run training for psychologists and teachers, so I mentioned it at my autism workshops around Australia, and it was listed on the Australian Psychological Society website. So we did pay people, not in money, but in a discount on ACR products. I'm not paid by ACR. They were kind enough to offer a 10% discount on their products if you participated in the study, and you also were able to print off a certificate to show that you'd done a case review, which counts as active professional development in terms of our hours that we need as psychologists. Okay, so looking at the sample, the difference that you get when you're working with assessments that have already been completed and people joining in an online survey is that you don't get nice equal groups. So you get what you get and you don't get upset. It's the thing that we have to remember with this kind of research. So we had 114 individuals with autism or suspected autism. There were only 2 or 3 where we didn't have a clear diagnosis. There were a couple where people had sent them off for an autism assessment and weren't sure of the results of that assessment. But the majority of those, I think 111 of them, definitely had autism, and 34 who didn't have autism. So I think part of that is that I see a lot of children with autism and not so many kids without autism, but also other psychologists who were doing this were kind of curious, and so they would pick someone with autism to do this with to see what kind of questions they got. So we had an interesting sample in terms of intellectual disability as well. So when we look at the whole sample, 46% were diagnosed with autism and an intellectual disability. 32% had autism and were high functioning in that they didn't have an intellectual disability. 6% had an intellectual disability but not autism, and 16% had neither. So when we're dealing with those kind of numbers, then we have to use things like chi-square analyses, for those of you who are into the stats. So that's where we have unequal numbers and we're looking to see what would be expected in each of the boxes and then what we actually got, so whether those numbers could have occurred by chance or not. Okay, so comparing the two groups, I don't want to say we had an autism group and a control group, because what we really had was a non-ASD clinical group, so they definitely had other things going on. So the autism group had more expressive and receptive language difficulties, more intellectual disability. So those first numbers are the autism group and the second number is the non-ASD clinical group. They had more sensory difficulties. My ethics committee told me that I had to group the difficulties together, so I put in physical and sensory difficulties together, but mainly it was sensory difficulties that we were coding. Social and pragmatic difficulties is not unexpected to be higher in autism. So then the non-autism clinical group had more learning difficulties, and I think that's where you're capturing kids who don't have an intellectual disability but do have learning difficulties. So we don't count children who have an intellectual disability as having learning difficulties, not specific ones. They tend to have a global difficulty, so we count that as an intellectual disability, not learning difficulties. And then there were some kids in the non-ASD group who had no additional diagnoses, and that was pretty rare in the autism group. Okay, so then there were similarities between the two groups in terms of their behavioural difficulties, their attention difficulties, anxiety, hearing difficulties, and other social difficulties. So not the semantic, pragmatic stuff, but more shyness, bullying, social immaturity, friendship issues that might have brought them in to see a school counsellor. Okay, so doing this kind of research, I didn't have control over which tests people were using, so I used the Griffiths, the Whipsy and the Whisk, but other people were using other things. Okay, so looking at the results, the first thing that I was interested in is whether people had a spiky or a fairly flat profile of test scores. So what that means is that when you're doing particularly things like a Stanford Binet or a Whisk or a Whipsy, so the Wechsler scales, you might do a number of different subtests. So we might do 10 or 12 or 15 subtests. And I find that kids with autism tend to have things that they're really good at and things that they're not strong in. And so I get frustrated when people are doing workshops on, say, the Whisk, and they say you must report index scores and not subtest scores because the index scores are more stable over time. I understand that's the case in the general population, but it's really important to report subtest scores in the ASD population, and that's why I go ringing psychologists and asking them for the subtest scores, because often you get this, they're just in the average range across everything, and actually they had nothing in the average range. So they had lots of 16s and 6s and nothing between 8 and 12, which is what we think of as the average range in terms of the subtest scores. So that's really important information. So that did come out in the sample that I had. So there were 52% of the kids with autism had a spiky subtest profile, whereas when you're looking at the fairly flat profile, only 36% of the kids with autism had a fairly flat profile. And this is collapsing across intellectual disability as well. So intellectual disability will tend to flatten out subtest profiles. So when you look at the kids without autism, 73% of them had a fairly flat profile. When you separate across the intellectual disability, then you notice that the spiky profile is particularly high for kids who had autism without an intellectual disability. So 63% of them had a spiky profile, and you'll notice that the kids who had an intellectual disability only, 100% of them had a fairly flat profile. So that's an interesting little statistic there. I'd like to slip that into some training. Okay, so why is that important? Well, when you're looking at kids in the classroom, one of the things we ask them to do is to take risks academically. And so if your experience is either getting something straight away or never getting it at all, why on earth would you want to do something new? And that's what we see with a lot of kids with autism, that they don't want to try new things. This is one of the reasons. Okay, so then we're looking at particular behaviours of interest. I did ask about 28 of them, and some of them were kind of, I had multiple examples of these behaviours, so probably actually more than 28 behaviours I was looking at, but 18 of them came up as significantly more likely to be displayed by the autism group. I'm running out of time. I'm happy to provide you with all of this in more detail if you email me. So there were 4 behaviours that were only displayed by the autism group. Many of them were quite significant, as in the chance of this happening was less than 1 in 1,000, so by chance. So these ones were particularly important, so being self-directed, needing breaks to pace or spin, being distracted by visual or auditory stimulation, helping themselves to the suitcase, and having difficulty sitting still, despite the fact that there were fairly equal numbers of kids with ADHD. So having autism was even more likely to get kids up and moving. And then we had some more significant behaviours at 1 in 100 chance level, and then some more at 1 in 20. So I'll skip through those and just tell you that I have made a cognitive assessment observation checklist. I can see some people interested in that. So it has 89 now because I missed one. Matching directly to the book when you're playing with blocks needed to be on there. So it's a one-page thing that psychologists can use when they're doing a cognitive or developmental assessment, where they can tick a box particular behaviours and then they can mention those in the report. And then my next step is to write a training workshop. So I usually do 2-day workshops on autism for psychologists. Now I'm looking at switching to a 1-day training workshop looking at this kind of behavioural information for cognitive assessments. So I'll be hopefully coming to a place near you, and I'd like to say thank you to all the psychologists who participated, and these are my contact details if anyone's interested in further information. Thank you.